We're going to flip the classroom and do a teaching session on administration of intramuscular injections. My name is Ceola Gilbert.
And I'm Cleola Taylor, and we're students from William Carey University.
This is a slide diagram of a needle to do administration of IM injections. You see the needle there with the cap has already been removed, and then the syringe and the plunger. During the course of nursing schools, students learn the skills how to administer an intramuscular injection. These skills are taught by the clinical nursing instructor in the school's clinical lab or in the clinical setting. These skills can also be taught in a simulation lab. And simulation is helpful when a clinical setting is not available. Also, a benefit of having a simulation lab, the students get to practice those skills before actually going into the hospital and performing them on a patient. Objectives for our IM injection administration. 1, you want to identify and locate IM injection site to administer the medication. Identify parts of the syringe, which we just identified the syringe. You want to dispose of the needles properly in a sharps container. Also choosing the correct needle size depending on age appropriateness. This is an injection site also used for administration of IM injections. There are 5 sites that need to be considered when administering intramuscular injections. 1 is the deltoid, the dorsogluteal, the vastus lateralis, the rectus femoris, and the ventrogluteal.
The deltoid site is used often for IM injections. It is selected due to its easy access and location. It can only be used for medication amounts up to 1 milliliter. To locate the deltoid site, you want to locate the distal edge of the acromion process. It creates a triangle shape near the center of the top portion of the arm. Give the injection in the middle of the triangle, or 3 finger widths distal to the acromion process with a dart-like action. The dorsogluteal site is located on the posterior upper outer quadrant of the gluteal muscle. It can be found by drawing an imaginary line from the posterior iliac spine, where the spine and pelvis meet, to the top of the greater trochanter, top of the femur. It is important to note that avoidance of the sciatic nerve to prevent sciatic nerve damage. The amount that can be ejected into this area is 4 milliliters. This diagram shows a syringe. You have the syringe, the needle, the plunger, and a medication vial. The vastus lateralis can hold up to 5 milliliters. This site can be accessed by sitting or in a lying position. Location of the site is done by laying one hand at the hip and the other above the knee, and give the injection in the mid-thigh, either laterally or anteriorly to the center of the thigh muscle. The rectus femoris can also hold up to 5 milliliters. This site can be accessed by sitting or in a lying position. Location of the site is done by laying one hand at the hip and the other above the knee, and give the injection in the mid-thigh area, either laterally or anteriorly to the center of the thigh muscle. The ventral gluteal site can be found while the patient is lying on their side in a prone position by locating the greater trochanter with your hand laying flatly on top. Feel for the iliac crest ridge and then spread fingers apart to make a V shape with the first finger and the second finger. Give injection in the center point of the V shape. This site is considered the best to give injections due to it being nerve-free and no blood vessels are in the way. It provides more muscle mass to give injections, and this site can hold up to 3 milliliters of volume. Therefore, it is highly recommended to use. This diagram, we have the dorsogluteal site. It shows the posterior superior iliac spine, the gluteus maximus, the greater trochanter of the femur, and the sciatic nerve. The deltoid site, we have the acromion process, the deltoid muscle, the scapula, the humerus, the deep brachial artery, and the radial nerve. The ventral gluteal site, we have the anterior superior iliac spine, iliac crest, the gluteus medius, and the greater trochanter. The vastus lateralis site, we have the femoral artery, the greater trochanter of femur, and the vastus lateralis. The injection site preparation is conflicting depending on the facility. Most facilities still require cleaning with a 70% alcohol prior to injection. Methods of injections are either the straight method or the Z-track method. It is used to prevent leakage of medication through subcutaneous tissues. The needle size can range from 25 milliliters to 38 milliliters for adults for IM injections, and the needle length is different depending on the size of the individual, if they're over 60 kilograms, or if it's someone weighing 90 pounds or less. To give an IM injection, you want to gather your supplies. You're going to need hand sanitizer, gloves, syringes, the medication, Band-Aids, and an alcohol swab. To identify your patient, you want to use 2 patient identifiers. You can use the patient name, their medication record number, or date of birth. Remember to check for allergies. Remember to explain the procedure, the medication, and the side effects to your patient. Verify the correct dose and aspiration. You want to use hand sanitizer, put on gloves, examine the vial, check for expiration date, clean the vial with alcohol and let it air dry. You want to locate the site, prep the site, make sure the bevel is up. You want to give the medication with a quick dark action at 90 degrees. Stabilize the needle. Aspirate, checking for blood, making sure you're not in a vessel. Inject the medication. Remove the needle. You want to flip the cover. Remember never to recap. Put it in the sharp box and apply Band-Aid.
At this time, we will go to part 2 of the teaching session. And students, I will need you to proceed to the learning lab at this time.